So my name's Kyle Rickner, and I'm originally from Oklahoma, actually born in Perry, Oklahoma, but we moved around a lot, and I graduated from Kingfisher High School in 1987, and then stayed locally to play basketball, which was really my passion growing up. Then I actually worked and did research in the clinic setting, and then followed that up with going to medical school at Case Western Reserve in Cleveland, Ohio. And then we eventually made our way back to Oklahoma in 2006, where I practiced for 9 years before going into direct primary care. When I first heard about direct primary care, it did not take me long. I made a decision that's what I wanted to do. And I think the reason that I did is it sort of gets back to the essence of healthcare, that doctor-patient relationship that's supposed to be at the center of everything that we do. And I had felt that that had been robbed and taken away from us, slowly eroding it over time, stealing time out of that office and creating other tasks for physicians to do that was not directly related to patient care and was not patient-centered at all. And so that really motivated me to do that. The other thing that everybody is aware of is how much the cost of medicine and all things related to healthcare has just continued to increase. And I hated that maybe I was part of the problem and not part of the solution. And I saw going into direct primary care as a way for me to become part of the solution and just bring a little common sense back to the chaos that had become medicine. And it's been so refreshing because the patients so appreciate it. We see such thankfulness and gratefulness. We see happier physicians, we see happier patients, and it creates an environment where health actually can come out of that, as opposed to one where sickness sort of reigned. It's almost like health reigns in the direct primary care environment because everybody's actually happy to be there, happy with the process, and happy to the value that it brings to their lives. My hope for my patients in direct primary care is that they really sense the level of care that they receive here, not just being seen, but actually being cared for. One thing we like to say at Primary Health Partners is caring is our commodity. And we take that seriously, and we try to approach our patients on a relationship level. It's been kind of fun to hear some of our older patients say, this is what I remember it used to be like. And so we took that and realized that we're kind of old school docs in a new world. Instead of a black bag, we carry a black phone. And it just sort of speaks to our availability to our patients, and I really enjoy that.